to the owners who say, but I've always fed bones and they're absolutely fine? What is your advice?
I would never feed bones, but sometimes they are fine. Sometimes they do move through, but I wouldn't encourage it. There is that chance that they get stuck. Then you're in for a lot of money to have these surgeries done just for openness. I mean, for clients coming in here for dogs that need surgery to have bones and corn cobs and things removed from intestines, you're looking up to 25,000 Rand. And I mean, that is just for the surgery and maybe one day post-op. That doesn't account for the fact that they need to stay until they have eaten and passed a stool, or complications such as a peritonitis.
A very warm welcome back to the Paws Effect Podcast. I'm your host, Dr. Cara, and in the studio today I have Dr. Emma Brown. Welcome
Hi, Cara.
back.
Nice to see you.
Thank you so much for joining me again.
Pleasure.
So I know we've done a lot of conversations around particular disease processes, and we have a huge library of these. We've got cardiac failure, we've got renal disease, we've spoken about pain, we've spoken about parvovirus. So if any of the listeners want to look back at some of those, they can do so. But one of the things that I realized that we haven't really tackled are the things that are presented to owners.
Yes.
So some of the clinical signs that we use to then lead us to a diagnosis.
Yes.
And I wanted us to discuss vomiting today. So vomiting is something that you often see. It's a very common thing on your list.
On our calendar nearly daily. And often the only reporting sign from the owners is that the dog has vomited.
Yeah. So,
or cat.
Or cat, yes. So vomiting, this is going to be something that we're going to just explore in multiple ways. One of the things I wanted us to start off with is the distinction or the difference between vomiting and regurgitation, just to be able to allow owners to distinguish between the two and know when it's a true vomiting episode.
Yes, so obviously that's where when we have our consult come in and they've reported vomiting, our first thing that we want to do is we want to decide whether it's actual vomiting or if it is regurgitation. So vomiting, basically, it can start with a couple of signs before the dog actually vomits. So they often look nauseous, so they're drooling. They can also be lip smacking, so just licking the lips quite a lot. Sometimes a little bit lethargic. Then they go into this sort of retching or heaving stage where they are like almost trying to bring something up, and then the end product is the digested food. So that's quite an important one, is that the food is digested and the food material that comes out is not your formed kibble. In comparison, your regurgitation is a passive expelling of food or water content. So the dog or cat might have just ingested something, and then a couple seconds later, it comes out again. And there's no signs before, there's no active abdominal movement or retching. It just sort of falls out the mouth.
And then the other thing that I think is really important just to get out of the way, because this episode is about vomiting, is the unproductive vomit. So I know you're doing a lot of night shift. I know from my years of doing emergency medicine and critical care, that typical phone call where you get my dog is trying to vomit, but they can't. Nothing is coming up. What does that do in terms of your alert? What does that indicate?
Ours all immediately a red alert. So in this, my brain jumps to a GDV, which is a gastric dilatation and volvulus. So what happens is the stomach dilates with air, and then it actually flips over on itself. So at the esophagus, where it enters into the stomach, that area can sometimes be twisted. The stomach continues to fill with air, and it can also drag with it quite a lot of important blood vessels. So the animals go into shock really quickly, and they can also die really quickly. And with the twisting of that esophagus, that's why they're not able to actually bring up the food. So that is an emergency, and you need to get your dog to us as soon as possible.
And this obviously typically happens in particular breeds of dogs or particular?
So mainly deep-chested, so those with quite a large rib cage, and then they go quite narrow at the abdomen, so and large breed dogs. So we thinking of like Great Danes, even Ridgebacks, Boer Bulls. But also saying that we have also seen a couple in Dachshunds as well. So little Dachshunds, we've also seen GDVs in as well. And then obviously your Sighthounds as well are also prone to them.
Yeah. So this is something we urge owners to come in immediately. An X-ray is taken in order to diagnose this, and this is something that is then managed surgically.
Yes.
As an emergency. Yes. So we've got that out the way. The thing about vomiting is that we can separate them into acute, so they've vomited a few times, maybe once or twice, and then chronic vomiting. And I'd like us to start off with the acute vomiting, that typical presentation. Like you say, it's on your list. My dog started vomiting or my cat's been vomiting. And generally how we approach these cases,
yes.
Because I think it'll give owners a bit of an insight into why we make certain recommendations. So one of the things we've spoken about before is owners are not always aware of the clinical examination that we do and the information that we're gauging from their pets
yes.
in the consult room. So we're often taking a history, and whilst we're doing that, we're doing a clinical examination.
Yeah.
Let's start off with the history part. What is the kind of information that you try and get from the owners to determine how serious this is, and to get the kind of information in terms of, say, the contents of the vomit? What are the questions that you're asking?
So once we've differentiated between vomiting and regurgitation and we're sure that the dog is in fact vomiting, I tend to see how many times that dog has vomited throughout the day, how long it has been going on for. And then I normally start with asking about the demeanor of the dog. So have they become really lethargic throughout the day with this vomiting, or are they still bright and jumping around and still a little bit playful? Then I will go into asking them if they've had any sort of dietary changes, or if they eat things in the garden, anything they've noticed, if they have certain toxins. So could they have gotten to something toxic, pesticides? We've had quite a few dogs eat drain contents. And then also the foreign objects as well as one on my list, that especially with younger dogs, to ask, do they eat soft toys? Do they eat bones? Do you feed chicken bones? Do you feed rib bones? The list is quite extensive. Cycads are another one that we do ask about as well. And then once we've sort of, established that, some owners are really good as well. They'll take a picture of the vomit and be able to show us. So was there food in there? If it was a whole lot of kibble, did they just eat really fast and, ran around for a while and then vomited? Was there blood in there? Could be suggesting some gastric ulceration or inflammation, or was it just bile?
So a lot of this information is allowing you to sort of take on the next steps in the course of action. But what are you gaining from your clinical examination? And I know you're quite practical. You're very thorough in terms of, assessing from like nose to end. What is the kind of information that you're gauging from the actual patient that might suggest that it's one thing or another?
So I think the most important one with vomiting is to establish whether there is an obstruction or not, because those ones we're going to want to act on really quickly, and those would possibly be surgical candidates. I think if you're fortunate enough to have an X-ray facility at your vet that you go to, any vomiting patient should have an X-ray done. It's not like people where we can say, oh no, the child absolutely didn't ingest something foreign, or we can say, no, I didn't eat something foreign. A lot of the times we've had people swear that they've never had bones in the garden or anything, and we take the dog through to X-ray, and lo and behold, there's a bone. So for me, I think most important is to differentiate between how sick is this dog with the vomiting. Are we just giving an anti-nausea medication and monitoring? So those would be in your little bit brighter dogs, or are we really dull? X-rays, bloods, how far are we going? Also the degree of abdominal pain, so your tummy pain, have they got hunched little backs? Are they really guarding their tummies? That can also point us. Is there also diarrhea? Is there blood in the diarrhea as well? Sort of those things can be helpful. And then also parasite control. So have these owners recently done deworming, because a lot of our gastrointestinal parasites can cause vomiting as well.
Hey there, pet parents. It's Dr. Kara, the Ultra Pet Vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultra Pet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultra Pet offers 100% money-back guarantee. Try Ultra Pet's premium recipe for short-muzzled dogs today. When we're tackling these sort of cases, like you say, the one-off vomits, they're still pretty bright. You're looking, we've had strange cases, and this is why this conversation about vomiting is so important, because we can talk about particular cases that we've seen of ingestion, for example, with cats, of ribbon and string and those kind of things. We may be very lucky and be able to see that, say, we look in the mouth and we see that. We may get a bit of abdominal discomfort. You may get nothing until, like you say, you take an x-ray, or you even, worst case scenario, you have to go in and do an exploratory laparotomy, and we'll talk about that too. But there is a lot of information that if owners, particularly the pets that are inside or, the cats, it's sometimes easier to get information because they're more visible in terms of what they're doing. But I know, for example, with my dogs outside, I often don't know, how many times they've vomited, for example. Yeah. Let's talk about some of the things that we assess as part of vomiting in terms of our patients. How do we assess for dehydration?
So in cats, it's quite nice. You can look at their skin tint, and so you just pull the skin up over the back of between the shoulder blades, and it should just fall down quite nicely if they're well hydrated, whereas if they are quite dehydrated, it will almost make a tent. Then you can also test to see how sunken the eyes are, the mucous membrane color. So are our gums dry? Are they really red? We also test something called capillary refill time, which is basically what you do is on the gum, you just press your finger on there and you are assessing for how quickly that color returns from white to red. Normally, if it's more than 2 seconds, we have some level of dehydration or perfusion problem in the animal. We can also look at their activity levels. A lot of these dogs that are very or cats that are dehydrated are very lethargic and just looking quite unwell as well.
Definitely. And like you said before, if it's vomiting on its own, it's one thing. But if they have diarrhea, the losses, if they've got a high temperature, they're dissipating heat there, they've got diarrhea, there's fluid loss there, and then vomiting, those kind of cases can progress quite quickly, can't they?
Yeah, and even, especially in the smaller dogs, but even with multiple episodes of vomiting during the day, it causes quite severe electrolyte disturbances from losing all these fluids, which is often why we do encourage owners that if they have had vomiting going on for the day and the animals are not being able to keep anything down, we do even just a drip for 24 hours makes a world of difference.
So let's talk about that. Let's go to that now and explain what we do when we are admitting, say, a dog that has been vomiting multiple times, because we essentially, if they vomited once or twice, they're able to take on food. We'll tackle that next. That mild case that you're going to dispense some stuff and they go home. But let's talk about the kind of what are the extremes that you go to? At what stage are you assessing things like electrolytes and asking for blood work versus just saying, look, they're not doing so well? Is it a financial decision or is it down to how severe the patient's looking?
So obviously from our clinical exam, we look at the hydration status. So if we have poor hydration, if our heart rate is up as well, that's another indication of dehydration as well. The temperature, have we got a fever? Have we not got a fever? Generally, if we don't have a fever, we're a little bit happier. Then rectal examination. So we will see if there's any blood in there that might lead me to do some more diagnostics. So often I'd take the patient into the back, and the first thing I would do is take an x-ray. That just gives me an idea of what the gastrointestinal tract is looking like, all the way from the stomach through to the colon and the stools moving out. And then obviously some foreign bodies we also have to realize can't be seen. So you're also looking for signs of gas in the small intestines or throughout the gastrointestinal tract. Where is this gas sitting? How severe is it? Is it really dilated? Is it a little bit of gas? And this will kind of indicate me towards sort of my next thing. Most of our patients should get a fecal float done as well. To see if there are any parasites. If that comes up clear, you can also do a fecal smear. That gives you an indication of the bacterial population there, because we have some nasty bacteria that can cause really horrible sort of colitis and gas. And then if gas is severe enough in the small intestine, or you see a foreign body, or you suspect one, we normally would admit them to keep them for serial radiographs, so continued x-rays over a couple of hours to see how that gas is moving. Can we now see something else? And then if they are quite dehydrated, have had a history of vomiting for a couple of days, I'd probably encourage bloods if they're feeling really unwell. I also tend to say to owners, because I understand bloods are really expensive, that if we do symptomatic treatment in the beginning, so most of these vomiting cases need to be on fluids, a little bit of pain relief, and some anti-nausea meds. That's what nearly everyone starts on. And that if we haven't seen a significant improvement over 24 hours, then we need to go ahead with bloods. So I think it's very case dependent. And then on cases where you also have a lot of gas, or you're not quite sure what's going on, there's also a diagnostic procedure called an AFAST, which is a quick abdominal ultrasound that assesses your liver, your kidneys, and your bladder. And we're mainly using this to assess for free fluid. So if you've had an obstruction and we have a perforation and we've got free fluid in the abdomen, right, well, now we're going to surgery. So there is a lot that we can do, and it's very case dependent. And most of what we do next comes from our clinical exam.
Yeah. And I think let's have a little bit of a discussion as to the kind of things that you may discover by doing that blood work, because we know, and you alluded to the fact that there are various causes of vomiting, and perhaps we can go into it now in terms of the things that are based just on intestinal issues and then external factors.
Yes.
But there are certain things that you are only able to gauge. You may get some clinical signs. Say the owner may notice that their pet has been drinking a little bit more, urinating a bit more. You may get a dramatic clinical sign that the mucous membrane color is yellow. But there are various things that may not show in those early stages of the vomiting that may not then lead us to a diagnosis without the blood work. So talk to us about what bloods we run and some of the information that we can gauge from it.
So firstly, like you said, obviously with vomiting, you can have it because of gastrointestinal signs, your obstructions, your parasites, a food discrepancy, or a dietary indiscretion. And then your extra gastrointestinal signs would be other organs that can cause vomiting, such as your liver, kidneys, pancreas, and those are cases where we like to look at our bloods. So we can look at our different parameters for kidney values. They also can give an assessment of hydration. How dehydrated is this patient? Do we have some sort of renal dysfunction? Are we in renal failure? We also have liver enzymes that we can test as well that could point us in the direction of that we've got liver inflammation, or our liver's not functioning. And then another really handy one is a pancreatic lipase test. So this tests for inflammation of the pancreas, and we've actually now got a quantitative one, which means it actually gives us a specific value for the inflammation in the pancreas. And those can all cause vomiting. This also can then give us a sort of a targeted organ approach to our ultrasound, because we can then say, oh, our liver values are up. Let me go and put the ultrasound probe on my liver. And then you either find a mass, or, our gallbladder's inflamed. And then same with the pancreas. It is gold standard that all of the pancreatic patients should have a ultrasound done of the pancreas to confirm pancreatitis. And in our older dogs, it gives us an indication, are there suspected cancerous masses there? And then we can make further decisions from there.
So true. And I mean, there are cases where, you spoke about before of palpating the abdomen, that either animals are in discomfort and they're boarding their abdomen, or the abdomen is too big to be able to get like a palpable indication of what's happening there.
Yes.
So obviously if they're in pain, and you talk about pancreatitis as one of the causes of vomiting, particularly in dogs, less so obviously in cats, but that you can't always, that's why I like the cats, is you can generally palpate them a bit easier, but you've got a large breed dog now, for example, it's difficult to palpate the intestines and feel potentially for a foreign body. So that workup of the x-rays, the ultrasound, and also having a look and ruling out some of the organ dysfunction is really valuable.
No, it is really helpful. Also, positions on the abdomen where they are painful. So those animals that are more painful in the front part of their tummies, that's where our pancreas sits. They are going to be quite sore there. Are we more sore towards, the caudal parts, so the back part of the abdomen? We have one of our vets who's really good at abdominal palpations, and she'll often be able to say, I can feel it right there. And most of the time she's been spot on. So, taking the time to palpate those tummies and have a feel what's going on there, especially for cats with inflammatory bowel disease. Those intestines are like rope in there, and you can really get a feel of what they feel like.
Yeah. I mean, like you said, these patients generally feel really awful. So let's go to the gist that we're going to deal with this, and hopefully it's going to be seen, it's going to be managed, whatever suggestion you're going to make now, and we hopefully won't see them again. So let's just talk about that. There's been a couple of vomiting episodes. Possibly there's a bit of salivation. They maybe didn't eat their food this morning. Those are, very typical ones. So we have spoken about some of the extreme stuff, and, we need to, because as listeners hopefully by now understand that the whole vomiting thing flags up lots of thought processes for us in order to rule out some things that are very serious. But let's say, off their food, vomit, we all see it. We've obviously, even as vets, we see
my own dogs.
See our own pets have that. What do we generally do in terms of managing just that acute 1 or 2 vomits, just to try and get them right?
So I think the main thing here as well is to know your dog. So a lot of people will say, no, I know there's definitely something serious, but they might just have had the once-off vomit. They're still running around the garden. They've obviously eaten something that's upset them, or it could even just be a viral thing that they've come down with. Those ones, they're bright, they're wagging their tails in the consult room. They're eating the nice food. So they're eating chicken that you offer them, but maybe not the pellets. Those guys, I'd often say, their clinical exam is great. Their gums are nice and moist. Their color is great. Their tummies aren't uncomfortable. There's no diarrhea. We would often just give those an anti-nausea medication. I like to throw in a little bit of paracetamol sometimes as well, just to, help with any sort of discomfort. And then we say to the owners that if there is any further vomiting after giving the anti-nausea medication, they have to come straight back.
So that's that key information that you give owners. This is what I expect. If you're getting this within this time frame, we need to see you again and be proactive about coming back.
Yeah. So I'd normally say to them, we've given them the anti-nausea medication, offer them some food in 3 hours' time. If we're not eating, or we vomited more and we're still not looking great, then it's serious and we need to do further investigation.
And how quickly does that injection start to take effect generally for your?
I normally say about an hour. I think they start to feel a little bit better. But those that are not going to be well, they will vomit. They will vomit again. So then that definitely warrants further investigation.
Let's talk about the bland food diet. So, obviously they've had a bit of an upset stomach, and we reach for it when they're hospitalized patients, but obviously when they're going home and they've had a bout of vomiting, sometimes even diarrhea, we're advising bland food. What is it about bland food and that dietary rest that we're trying to sort of advise owners to do, and for how long are they doing it?
So it's normally just the chicken and the rice are very digestible. There's nothing not very fatty that could make our pancreas angry or cause inflammation in the body. It generally will just pass on through. It's also very palatable. So a lot of the dogs really love a piece of chicken. So that's encouraging them to eat. And we normally do this, I normally do for like 2 to 3 days, just so that their appetites are good, they're interested in their food, they're eating, and you know also how much. Did it eat 1 chicken breast, 2 chicken breasts? We can sort of gauge how much they're doing, and it just gives time for the inflammation in that gut to go down, and then reintroducing their normal diet again.
Absolutely. And there are obviously some prescription diets that are intestinal-based diets that are more balanced, that if we have got an inflammatory process or inflammatory bowel disease, that we may have our patients on longer term. But like you say, just a few days, if it's chicken-based food that you're just trying to give some dietary rest, it's a short term, it's not a fully balanced diet, but it's enough time just to settle the stomach down and provide them with some adequate nutrition for a period of time so that they can then resume their normal diets.
Yeah, there's a lot of really good gastrointestinal foods on the market, and we generally send them home either if they can afford to do that for them for a couple of days. I'd do that. But if not, then chicken and rice is a really good one.
Yeah. So we've ruled out that one, and hopefully we don't see them back. But okay, they are back. We're having them back in, and we're going to admit them. What is it about fluid therapy that makes them feel so much better?
So it balances all the electrolytes again. So a lot of the time when you are vomiting a lot and passing a lot of diarrhea, you go into a state of acidosis. So being quite acidic, your electrolytes are all out of whack. You're feeling horrible. You're also not able to keep anything down. So you're not able to absorb anything, no energy from there. So the fluids replenish our electrolytes. They improve our hydration, and anyone that feels hydration and has, a really good electrolyte balance is, already feeling a lot better. So the fluid therapy really goes a long way.
Yeah. And I think for the listeners who are hesitant to leave their pets in the hospital, there is a lot to be said about rest.
Yes.
But also about us being able to observe them for a period of time. When we can see, okay, has the vomiting fully settled? Am I needing to up our game in terms of this dog is deteriorating? In comparison, we take serial measurements, whether it's temperatures, assessing for hydration status, we do clinical examinations all the time on these patients in order to see, are we seeing an improvement and they're making an improvement, or are they deteriorating?
So I really like this approach for animals where the owners suspect they've ingested either a toxin or a foreign body that we can't see on an x-ray. For toxins, we're able to see, right, are we deteriorating? Is the vomiting getting worse? Are our clinical parameters getting worse? Are they pointing us in a certain direction towards a diagnosis, at which point we can, say, right, I think it's this or it's that. And we are, because being 24 hours, we are right there to see what the vomit looks like. Are they starting with diarrhea? How are these patients looking? Do we need to repeat x-rays? Is the gas moving? Do we need to move on to a different sort of diagnostic approach? But I'd say the ones that I do this the most with would be the ones where I'm suspicious of a foreign body or a toxin ingestion that the owners are not quite sure of, or if they have ingested something that they know, but we are a little bit unsure of the clinical signs.
Yeah. And we do have a lot, and you made mention of it before, about that symptomatic treatment versus diagnostic workup. And there is a fine line to be able to kind of make that call as to that this pet is not improving on the provisional care that we're giving, the fluid therapy, the antiemetics, the pain relief. This dog, cat, whatever the patient is still really painful. There's going to be the ability to have that conversation, like whether it's a case of we need to do something as serious as a exploratory laparotomy, or we need to do an ultrasound, or we need to do serial measurements. So I think owners are very reluctant sometimes to give us their dear pets because they don't want them to be away from home, but also because of the expense associated with it.
Yeah, and a lot of other times as well, especially with the blood work, it's important to remember that even if we get a blood panel that is completely normal, that is so reassuring because we have a baseline to work off of now. We know that our organs are functioning as they are. So a normal reading is a win. Even if we do these bloods and we don't find anything, I'm really reassured by that. It is sometimes good when we do find things so we can get to the bottom of it. But a lot of the times these things do require, continual diagnostic workup. As you also said with the exploratory laparotomies, to go in and investigate. So this is obviously where we get to a point where our x-rays are showing us, signs that it is warranted and we need to go in. But it's difficult to explain to owners that we could go in there and find exactly what your dog has eaten, but we also might be going in there and not finding anything, which is also a relief. We have a medication that helps with the kinetic or the movement of the intestine, and we're sometimes very reluctant to give this if we haven't ruled out a foreign body. So doing an exploratory laparotomy allows us to say, right, there's no obstruction there. We can now proceed with the next step of treatment to see if this will help. Ultrasound can also guide us with that as well, but we do have to use drugs really carefully as well.
No, you're right. I mean, that mention of using an injection that will aid with the motility, you do not want to be messing around with the motility of the gut if you have a foreign body there, because you can make it worse.
Yeah, ultimately. And that's why these, diagnostics are so important. Often when dogs and cats do come in, the owners are, adamant that it's just an upset tummy. Can we please just give an anti-nausea medication and be on our way? And, and your pet is vomiting for a reason. And with any of the anti-nausea medications, written in big letters in our formularies are rule out gastric or foreign body obstruction. And the only way we can really do that is with an x-ray. So when you do go to the vet for vomiting and your vet is asking for an x-ray, this is why, because there are, cons of just giving anti-nausea medication and sending you home.
Yeah. And especially then if you may manage some of the symptoms, so you may not have vomiting for a bit, so you're not proactive then about potentially coming back and saying they're still not well, by which point that obstruction could now have caused major damage to the intestine.
For sure. I mean, we've had dogs that have had obstructions up for 36 hours because they get the anti-nausea medication, they improve a little bit, and then they're vomiting again. And that is also why it's nice to have them in hospital, because we can see as soon as they have vomited again, we can take an x-ray at that point and, see how you're going. With these obstructions, our main fear is the perforation of the gut. And once you've got that, it's a terrible consequence. You get septic abdomens and they have a really, really poor chance of recovering.
Yeah. So let's talk about what you do if there is a foreign body. So we said we're going in for exploratory. When you discover from your exploratory laparotomy there is a foreign body, there are potential ways in which you're going to now relieve it. If it's very severe versus just making an incision and removing that, can you explain to owners about the actual procedure and potentially some of the risks associated with the surgery?
Yeah. So I just want to add, as well as our x-rays, we can also do something called a barium study, which is where we ask them to eat a contrast medium, so like a bit of food that will show up on the x-ray, and we can see that move through the intestine. And if that's not moving, then we also know that there is an obstruction. So we've decided to go in for our x-lap, and basically what we do is we do it in a very methodical way as not to miss anything. So we're starting at the stomach. We are moving all the way through the duodenum, then jejunum, your next part of your intestine, all the way till the ileum, which is where your small intestine then goes into your colon and it can be moved out. Any foreign bodies in the colon, they should move through. So now we've found our foreign body. Normally, if it's just stuck in the stomach, that's quite easy. We just make an incision in there, fish it out and close up the stomach, and we're all right. When it gets to the intestine, it's a little bit more tricky. So if you're lucky and it's caught early, we can just make a small incision over the foreign body and take it out, or milk it through to the place where it is. However, consequences of these foreign bodies being there for a long time is that you get your intestine starts to die. That can either happen from it being stuck in one place, or your intestine starts to telescope, so called an intussusception. At this point, we are assessing the color of the intestine. So is it nice and pink? Is it moving? Or is it dark red, ranging from to black? And is it moving? So when we are seeing very red, angry intestine, obviously towards a black color, you can do a little prick test with a needle to see if it bleeds. If it's not bleeding nicely, then you're going to have to resect. So you're going to have to cut out a section of intestine and then stitch it back together again. And this is where our risk of the surgery goes up and our risk for recovery goes up, because having to, stitch those two ends together is really tricky as well. Not only that, it depends how much of the intestine you have to remove. You've got good reserves, but if a large portion of it is damaged, it's going to really affect it.
And what happens when you get leaky contents post-op?
Then the other risk, obviously, as well, is if you have your gut contents leaking into your abdomen, you get a condition called peritonitis. This is incredibly painful, and it's basically just free fluid floating around in the abdomen, and they get raging fevers. I believe it's incredibly painful as well. That involves continual flushing of the abdomen surgically, and sometimes the placement of abdominal drains.
And this can be fatal.
Yeah.
So this is very
not
serious.
Many. The odds for peritonitis are not favorable.
So, we're talking this and we're talking about the serious stuff, and hopefully, the vomiting is not associated with a foreign body. But, the take-home message here really is that we would encourage you to be more proactive than, particularly with continuous vomiting, when they're looking miserable and they're salivating and they don't want to eat, rather than delaying, because these conditions can be managed when they're in the early stages a lot easier with better outcomes. Than
especially when these dogs are so lethargic, dehydrated, and they have compromised intestines. When you're dealing with that and trying to get the health of your intestine back, these guys have got a long way to go, versus a dog that you get in after 2 hours of eating a bone and you're like, it's eaten a bone, she's vomited, there could be something stuck. Cool, well, now we just go into the stomach and take it out, or we just cut over the intestine to take it out, and they're on their way home. Their recovery time is a lot less.
And to the owners who say, but I've always fed bones and they're absolutely fine, what is your advice?
I would never feed bones, but sometimes they are fine, sometimes they do move through, but I wouldn't encourage it. There is that chance that they get stuck, and then you're in for a lot of money to have these surgeries done, just for openness. For clients coming in here for dogs that need surgery to have bones and corn cobs and things removed from intestines, you're looking up to 25,000 Rand.
And with no guarantee that you're going to have a favorable outcome.
No, and that is just for the surgery and maybe one day post-op. That doesn't account for the fact that they need to stay until they have eaten and passed a stool, or complications such as a peritonitis, or even other organ problems, so renal kidney problems, liver problems, things like that.
So true. So let's go back to a little bit of a nicer point, that just the kind of things that may cause vomiting in our pets that owners may not be aware of. And we've just made a mention of bones, which is on the extreme end of it. But you made mention of pancreatitis. What is the kind of thing that might set off a pancreatitis?
So a lot of the times, especially in dogs, it's eating quite fatty foods. So those that are feeding pork sausages, tidbits from the table, pieces of bacon, not your normal lean chicken. So that would be one of them. And then cats normally it's just an inflammatory condition that causes the pancreas to become inflamed.
Cats are a little bit more discerning, aren't they?
Yes, cats like to hide their problems very well.
Yeah, they hide their problems, but also they're like, no, I don't want to eat that.
Yeah, very, very picky.
So, and then you made mention of things like deworming. So, owners, how frequently should they be deworming in order to avoid a worm burden that might be causing vomiting?
So there's a lot of products on the shelf for vomiting. For worms. So you need to, when you go to your pet shop or your vet, which is what I would recommend where you buy your dewormer from, I would ask them, how long does this dewormer last? How often do I need to do it? Some are monthly. Most of the ones that I know are monthly. Sometimes dogs have such a high worm burden, we have to give them certain wormers for 3 days, 5 days, especially, not all of our worms are covered. So Giardia in young dogs is not covered in our normal wormers, and they normally have to have a 5-day course of a specific type of wormer with a specific ingredient as well. So it's very important to make yourself aware of what worms and parasites you are treating with your chosen wormer, and even just to have a chat with most of the people behind reception at the vet practices, have the knowledge of what these wormers do and the frequency. So just make sure you are dosing appropriately for the product that you're buying.
Absolutely. And I want to just, before we wrap up, we made mention obviously of some of the organ dysfunction, things like early kidney failure that you may notice, chronic kidney failure that may cause vomiting.
That's a big one in cats.
Those are some of the things that we help owners with in terms of maintaining their hydration status. Can you talk us through how you deal with those in terms of what owners can expect?
Yeah, so our kidney patients, whether it's a cat or a dog that is presenting in renal failure. In cats, I think it's a little bit easier to pinpoint. They normally are skinny cats, dehydrated, vomiting, those older cats that we normally want to run a blood panel on. Thereafter, they are put on fluids and anti-nausea medication for at least 48 hours, at which point we then retest the kidney parameters to see if they have come down. Sometimes it could just be an acute kidney injury that has caused marked dehydration and they're fine. And then we would sort of just monitor these kidney parameters in the next couple of months. But our chronic kidney patients, we're not fortunate that like people, you can go for dialysis every day. A lot of the time these parameters don't come down, and it's a case of discharging them with, some appetite stimulants and anti-nausea medication, and even to the point of owners being able to give fluids under the skin to help maintain them at home. But it does get to a point where, the vomiting can't be controlled and they can't keep anything down. Yeah. And they are heavily reliant on fluids.
This has been really informative. Thank you very, very much for going through this. It's quite a big topic, isn't it? Because it really does touch on so many possibilities, which is why we urge clients, when the receptionists take that phone call and it's, my dog's been vomiting or my cat's been vomiting, to say, come in, let us assess, because there are so many directions this can go. Even that once or twice off in order to be able to give them some relief. Nobody wants to feel nauseous. It's a terrible way to feel, like nauseous and off your food. So even giving that sort of basic treatment can make a big difference for these pets.
Sure. And sometimes we even just do some subcut fluids in the consult room and some injections to send them home. But I think to know that vomiting can have serious consequences, and I think today we've just picked at the iceberg. But if your dog is vomiting, bring in to us so we can have the conversation and assess how serious it is. Worst case scenario, you're going to be in for an x-ray and told everything's going to be fine and you're going to go home. But you'd feel terrible as well, as if, we didn't pick up that vomiting, we didn't do the x-ray, and, we're in a serious situation. So vomiting is serious, and we do need to see them for it.
And be proactive.
Yeah.
Thank you, Dr.
No problem.
Very, very informative. And to our listeners, if you've enjoyed this podcast, don't forget to subscribe. Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.